Good afternoon. And today we have a pleasure of interviewing Dr. Tom Larkin. And just like we put on introduction, oral systemic mastery. Good afternoon, Dr. Larkin.
Hi, it's a pleasure to be here.
And in today's episode, we're gonna explore how dentistry is evolved and how this profession become from procedure-based to prevention-based, biologically focused, and systemically integrated field. We're going to talk about something so close to my heart. We're talking about oral systemic connection and specifically microbiome testing and modern approach to periodontal disease beyond clinic and surgery. And we're going to talk about something what really evoked my curiosity, ozone therapy. And very simple thing what we do every day, or maybe we should not do every day, flossing. Is flossing outdated or not? But most important, without any joke, how dentists can be key players in early disease prevention, detection, inflammation control, and whole body health. And I just want to mention before we start the program, Dr. Larkin gonna have a symposium in Lexington, Kentucky, oral systemic mastery on April 24th.
Right.
And he's gonna talk about future of dental hygiene and very important about systemic connection. So I'm gonna ask you that first question about flossing. You put in your, protocol what flossing is. That. What should we do besides flossing?
Well,
I'm all puzzled.
here's the thing. The definition of insanity is doing the same thing over again and expecting a different result. And in the dental offices, the dental hygienists are constantly telling patients to floss, and 95% of the patients don't floss. And it's just it's a constant. So why don't we talk about, is there a different approach to cleaning the teeth in between? And there actually is some evidence-based research on interdental stimulators, floss picks, okay? And there's a couple of different brands. There's TePe, GUM makes a brand that you can buy. And it's a way to clean in between your teeth that it's much easier to do. And it's extremely effective because flossing, to a degree is not very, very effective. Someone once told me it's very hard to floss a concave surface, like the inside of a bowl. You can't floss the inside of a bowl. So I joke about that, but I want my patients who don't floss to know, hey, there are other alternatives. And then using a water flosser is a well-established. There's a lot of research around that, and I've recommended that forever. And there's different forms of water pick. There's one called a Hydrofloss that has a magnet in the handle itself, and the water is ionized and it repels the formation of plaque. That's been around for decades. Hydrofloss is nice. But the most important thing to remember if you use an irrigator, put some type of an antimicrobial in there, something that's going to kill the germs as you flush your pockets out, right? So we have lovely alternatives to flossing, which no one wants to do.
No, that's we're talking about coaching, but maybe understanding the meaning of it can bring more accountability, I guess. So I want to ask you about a microbiome, about salivary testing. Yes, we are doing salivary testing in our office. And, when I learned about that, I was so excited and so many diseases connected to that. Now, simply perio have a systemic risk. But what puzzled me, really, truly, I see the patient who actually don't have a risk. They actually have a disease, and the risk is lower than for patients who don't have a disease.
Right.
So yes. I want to know what your opinion about microbiome testing. I know we're just in the beginning of that process, but you are guru, you are expert. What do you think about that? And I want you to talk about your own Larkin protocol as well.
Okay. So, and once again, as you said, this is evolving, and I have new information. I have new faculty come to my meeting, and there's a new salivary test that's going to be introduced at my meeting next month. And so salivary testing for the oral pathogens has been very confusing for a lot of dentists, okay? And there have been several mistakes made along the way. Very early on, 10, 15 years ago when it was first introduced, and the new dentist to do the new test would get back a report, and there would be a recommendation of an antibiotic, okay? And I'm very conservative, and I know you're very dialed into functional health, and I think antibiotics should always be a last resort, not a first resort. So what we did with salivary testing is we taught the early adopters an incorrect way to approach it. You have pathogens above threshold, prescribe an antibiotic. Well, that was incorrect, and most of the companies have kind of backed off. One of them now has on the test an antibiotic or a laser, okay? So this concept of we have an awareness that the oral microbiome is over 700 beautiful bacteria, consummate bacteria, that they are the friendly bacteria, but we have a very small group of pathogens. They are the ones that cause the issues, okay? So how do we deal with the pathogens? And we deal with them with what's called biofilm disruption. And that's an entire variety of things. But what I want to talk about is this new test that I've learned about, which is not a bacterial test. It's an inflammatory enzyme test. This is a point of care test, which means it's done chairside, and the results are in a few minutes. Now, what I've learned and what I will be learning in the coming months is that this particular test, it's called AMMP8, and it looks at, it's an enzyme for collagen breakdown, okay? Now, this is a different way of looking at the stability of your oral health. When I look at a sample of bacteria under the microscope, I see basically what I'm assessing is activity, how much the bugs are moving around. And if a sample is very active, that's dysbiosis. And if there's no activity, that's health, okay? But what the MMP8 enzyme looks at is it quantitatively gives you a measure of collagen breakdown, which is actual tissue destruction, okay? And as you know how important collagen is in everything, correct? So I'm thinking about this and I'm going, okay, so now I have a predictor 6 to 12 months before clinical symptoms, okay? So the Larkin protocol is basically the early diagnosis of oral dysbiosis, early diagnosis and treatment. So the term is very broad. It includes testing, it includes teaching, and it includes treating, okay? So it's not just one thing, right? So when we look at the bacteria and we have an elevated level, in a young patient, they may not have any destruction at all because their immune system, which is really vital in this whole thing, this is all about the immune system, but their immune system is handling it. So if they have an elevated bacteria, is that really meaningful? I'm beginning to question that, right? But if they have an enzyme that shows me that collagen is breaking down, they are actively at this moment getting destruction. So what I see happening in the coming years is that we're going to approach this testing. You know, everybody embraced the testing. This is great. This is great. But I want to tell you, 90% of the dentists don't know what to do with it. They really get stuck with it. Okay. The other thing that I will tell you is that I'm very leaning towards point of care testing. As you know, you do a beautiful comprehensive exam when someone comes into the office, and to be able to give them the results in real time while they're there is important. When you send a test off and you get it back in 10 days or 2 weeks, then you contact them. Then they have a million questions, and some of the questions have nothing to do with what you do. And it gets very frustrating and confusing. So what I love about this particular test is that I will have it at the conclusion of the appointment. And then the other thing that I'm very, very interested in specifically is this same machine can test for vitamin D. And I am a huge proponent of vitamin D. I have been personally, I've always optimized my personal vitamin D because of the cardiovascular program that I've been a patient in for 14 years. I've always run my D high. And I got to tell you something, I think it's important, okay? So now I have collagen breakdown, I have a number. Is it happening? Is it not? And I have your D level. And I saw some research from a Dr. Miguel Stanley in Portugal. He had a webinar last month, and he did a study of well over 1,000 patients of all ages, all demographic. And he said there is an absolute correlation between vitamin D and MMPA. And I'm fascinated with it. So I'm so happy that you're asking me this question, because my thoughts are in the process of changing how I'm going to use testing. It's not that we don't use testing, but how do we interpret it? Because I think what's happened is there's been a universal point of confusion as to what an elevated level means, right?
Yeah, yeah. But now I want to ask you towards the treatment. So yes, antibiotics, and I cannot say it's an old protocol, because a lot of companies still recommending antibiotics.
Right.
For Porphyromonas gingivalis and all
Right.
of, all the heavy pathogen or red group. But there is something else.
Right.
And it's also really close to my heart, ozone therapy. It's presented as almost magical. It's actually biological. But when you do something, like, what is it? And how long the effect lasts, and how it's outperform, conventional.
So to make it understandable, because I know you have a varied audience of professional and some lay people, and I never like to get too complicated or too much into the weeds. So ozone is O3, okay? And what it is, it's oxygen, water with an extra molecule, okay? And what you need to understand is I consider it completely holistic, because it is a very effective antimicrobial, antiviral, anti-everything, antifungal, but there's no chemicals involved, okay? So what it is it's an unstable molecule. You have to make it, and the minute that you make it, it wants to revert back to its original form. And it's in the process of breaking down to its original form where it has an oxidative reaction, and that's where it kills very effectively. So there's two forms in the dental office. And I really kind of did my deep dive during COVID, because I really thought that I saw all the dentists getting, oh my gosh, we have aerosols with COVID flying around the room. And I was like, why don't you have ozone water in your Cavitron? And there's no molecules flying around the room, right? So I really started to train up about ozone water in the office. And then I learned about a new company, this is after COVID, a company called BioSure, that began to be sponsors at my meeting. And I learned about it. And their technique is electrolytic, meaning ozone water is a very difficult thing to make. Okay, it's a process to make it. And once again, it's unstable. But this company has a technology that makes it so it comes right out of the tap in a very high concentration. So when the hygienist fills up her bottle at the beginning of the day, up until noon, she has a very effective antimicrobial. That's air water syringe, that's Cavitron, that's everything. Okay. So the company is getting very close. I talk to the CEO on a regular basis, FDA approval, and that's a very expensive, arduous process. But in the next year, it will become the standard of care in the office for water. Every bit of water, every sink in your office should have ozonated water. Okay. Now, the other component is ozone gas. Okay. Now, I don't have formal training in ozone gas, and I have not personally used it, so I don't want to talk out of school as far as, but I know how it works, and I know people that do use it. Okay. It does require training. Ozone gas is very irritating to mucous membranes. If you inhale it, I've inhaled it one time. You'll never do it twice. Okay. You will cough your lungs out. It's very irritating. But once again, very effective antimicrobial, antifungal, anti-everything. Okay. Holistic, no chemicals. Okay. So it can be applied in a variety of places in the holistic practice. It can be used to disinfect after a cavity is removed from a tooth. The tooth can be disinfected with ozone gas. There are custom trays that can be worn, and the gas is put in for periodontal treatment and effectively treat the gums. And once again, because of the technical nature of it, because of that oxidative process, it targets gram negative. Those are the pathogens. Those are the ones that live under the gum without oxygen. So we are going specifically after the bad guys. There's a lot of conversation in dentistry right now on social media about mouth rinses and don't use them because you kill all the bacteria. You don't want to kill the good and the bad. And there's a lot of conversation around that distresses me, because many things that we do kill both the good and the bad. A mouth rinse will kill the commensals and the pathogens. But what happens is the bacteria rebound. They come back and there's less pathogens and there's more commensals. Okay. So I don't get all freaked out about using strong approaches, whether it's ozone gas, ozone water. You know, you can pick whatever, chlorine dioxide, any of those. Okay. I'm completely fine with it. Okay.
So you don't think we should stop using the Listerine or chlorhexidine?
Chlorhexidine, I've never liked. Okay, I've never liked chlorhexidine from the beginning. Never liked it for a lot of reasons. Now we have many products, molecular iodine. There's a lot of good antimicrobials outside of chlorhexidine.
But I would like to ask you your approach to oral hygiene at home. What do you think would be the ideal oral hygiene? What we hopefully have to teach our patients to follow, to have a successful result after ozone therapy in the office.
Right. So the first thing that is not very common culturally in the United States is tongue scraping. Tongue scraping is absolutely essential. There is so much biofilm and there's so many pathogens in your tongue. And like I said, there are cultures where this is very common. That's a number one addition to that 90% of people don't even know about. Okay. I prefer technically a stainless steel because to me, it just feels better. They're plastic ones or whatever. Okay. So we're going to use a tongue scraper. We are going to use a soft bristle brush, and or if you want to use Sonicare, there's plenty of research that goes into sonic toothbrushes being effective. But the most important thing is soft bristles and not being aggressive. You can damage your teeth if you're too aggressive. Okay. Now we have to pick a toothpaste. Okay. And there's all kinds of toothpastes on the market, and I'm in the process of trying a new one that's a precision antimicrobial. But to me, which has always been a wonderful product, is anything with baking soda. Baking soda is a great misunderstood antimicrobial, not only from the pH standpoint, very low abrasive. People misunderstand that. On the abrasive scale, baking soda is very low, okay? And it's very inexpensive. So Kai's therapy, which was what I learned back in the 1980s, which is still effective today, it's very inexpensive, is hydrogen peroxide, Peroxyl being the brand that you get at the pharmacy, okay? Mix some hydrogen peroxide in the baking soda. Great toothpaste, okay? And then you're going to get
back to the old school.
Absolutely. There are so many things that were done years ago that still relate today. So another thing that I will do, and I talked about the floss picks, I will take that little slurry of hydrogen peroxide and baking soda, and I'll push it in between, especially the posterior teeth, and push it in there in between the teeth with the soft pick. And you're disinfecting in between the teeth. That's the whole thing, right? Flossing is, for most people, it's too cumbersome with their hands, right? And this way you're selectively placing the antimicrobial, because remember, what we're talking about is biofilm disruption on a regular basis, right? Every 24 hours, we need to make sure that all of the biofilm on the teeth is removed or disrupted.
So that's a very clear thing, and kind of have a deep historical roots.
Yes.
And my last question to you would be, what one belief in dentistry you think would look, what we have now would look completely wrong in 10 years?
Oh, well, there's more than
maybe
one.
Not one, maybe not one.
Yeah. The main thing is the big division. Now, this is not only dentistry, but it's in medicine, is reactive care versus proactive care. This concept is, as a trained dentist, as I was trained in school, I react to the disease process. You come in with a hole in your tooth and I react, okay? For me to be proactive saying, there's no reason for you to ever have a hole in your tooth. I need you to do A, B, C. Same thing with the gums. We react. You have pockets, you have infection, and we react. Now, unfortunately, the money is in reactive care. The money, okay? And money drives a lot of things. Same thing in medicine. How is medicine set up? Primary care medicine. You go in and you tell them a symptom and they give you a prescription, right? And that's the system. Okay, so that's a broken system that is beginning to decay. That system is breaking down, and it's breaking down because patients are becoming more educated. They're looking for people like you and saying, I want this type of a dentist. I want this type of a doctor. I don't want disease. Please help me how to prevent disease. If you look at some of the higher profile people, Tony Robbins, Gary Brecka, and some of these people that are, having all of these restorative clinics, whatever you want to call them, with peptides and hyperbaric chambers and everything. And they're charging a phenomenal amount of money, but they have no shortage of patients, okay? People understand our healthcare system, both in dentistry and medicine, is broken. And they're tired. They pay huge premiums, huge deductibles, and everything goes out, right? And these poor people that lose all of their teeth and have to get a complete implant reconstruction are paying $60,000 on average for a new set of teeth. And what they don't understand is that if you lost your teeth because of periodontal disease, that's the number one risk factor of losing your implants in 10 years, is periodontal disease. It's crazy. It's great. It's all education. It's all communication, education. You and I need to tell the truth. Sometimes the truth hurts, right? It's controversial to tell the truth.
But, it was last question, but now really last question. When we talking about prevention and going back to the microbiome we discussed earlier, are we really changing patient microbiome with periodontal care? I know I did retesting. It's true, and the results they don't look like the results that test representative show me how it all should look in green. And I explained to myself, probably patient does not follow my directions. Right. So from your standpoint, can we really change the destiny of the patient in the term of periodontal disease?
Yeah. So periodontal disease cannot be cured, but it can be maintained. And I learned that from a microbiologist to kind of change my terminology. So because this is a dynamic affliction, okay? It's dynamic because your immune system, number one, your immune system is going to vary for a million different reasons. How you react to those bacteria. Like I said, some people have pathogens, no problem. Some people have a few pathogens, a lot of problem, okay? So that's why we need to have what's called personalized medicine, personalized dentistry. Every approach is custom to the patient. It takes time. It takes intuition. You and I talked about, the exam that you do. It's very, very thorough. It's very thoughtful. That needs to be the standard in the future. There will always be reactive dentists. They will probably always be in the majority, unfortunately. But the number of people that are becoming proactive, as long as I've been preaching for 15 years, is growing dramatically.
Thank you very much. It was a lot of useful information, and I hope our audience be able to visit your website, tomlarkin.com, and people who are interested can attend Oral Systemic Mastery Program on April 24th in
Lexington, Kentucky.
Yes. And learn a lot of things about systemic health, including reversibility of cardiovascular disease.
100%.
I know you're really big on reversing the damage in the vessels because your vessels is your age.
Everything.
Yes.
Yes.
Thank you very much. I really appreciate your wonderful expertise, doctor.
Thank you.